Hi, Miss Deborah. My name is Ifoma Obadike. I am a student nurse practitioner, and I will be doing an assessment on you, head, neck, head, ear, eye, and neck examination on you today. Is that okay if I record it because my instructor is going to be viewing it on YouTube? Do I have your consent to do that?
Yes.
Okay, thank you very much. So I'm going to start my assessment by washing my hands. I'm going to wash my hands with either water or soap or with alcohol base before I start an assessment. So at this point, I just finished washing my hands. I am going to start by inspecting your hair. So I'm going to inspect your hair. Is that okay if I untie this for you? So I'm untying this, so I'm inspecting the hair because that's the first thing that we do. I inspect the hair, then I palpate the hair. I am inspecting the hair for symmetry. I am inspecting the hair for any contour. I'm inspecting the hair for any lesion. So after I finish inspecting the hair, the next thing I'm going to do is to palpate the hair. I am palpating for any lesion, any contour, any depression. I am palpating for any hematoma, which there is none here. Palpating for any hair loss, which is known as alopecia, and there is no hair loss at this point. The hair is clean, nice, and intact. So as I finish this, the next portion of my assessment is your facial. So I am going to be doing the facial. The first thing I'm going to do is, I just don't want to back the camera. So the next thing I'm going to do is to assess the face. I'm assessing the face for symmetry. I'm assessing the face for any involuntary movement. I'm assessing the face for any lesion. So after I finish assessing the face, I also have to assess like the eyebrow and the eyelashes and all that, making sure they are symmetrical. So I will go down to the next portion of my assessment is to palpate the sinus, the frontal sinus. This is the frontal sinus, and this is the maxillary sinus. And as I'm palpating this, I want you to tell me if this is the frontal sinus. Tell me if you're having any tenderness or any pain. Are you having any pain or tenderness?
No.
What about when I palpate the maxillary? Are you having any pain or tenderness?
No.
So this patient is good. There is no any pain or tenderness while I am palpating the maxillary and the frontal. So my next test for this patient is going to be the eye examination. And when I'm doing the eye examination, like always, all we do is to inspect first. So I am going to be inspecting the eye for any jaundice. I'm inspecting the color. I'm inspecting for toxins. I'm inspecting the eyes for the eyelashes. I'm inspecting for any discoloration, any redness. I am going to pull down the lower part of the eyelid. I'm inspecting also for any yellowish or anything that can be a sign of jaundice. And it's expected to be white. And then the inner corner here, eyelid here, is supposed to be pink. So which has is? I'm looking at the second one, and it's all white and the pink. So that is what I am going to be doing. So the next step after I finish this, I am going to get my pen light, which is on this table, and my ophthalmoscope. So I'm going to use the Sinus chart, and I'm going to ask the patient to read from 6 feet, and then so reading it from 6 feet, if she closing one eye at a time, I'll let her read. Then after that, I'm going to let her close the other eye and ask her to read. Then I will let her read the same thing from 6 feet with both eyes. And if she gets everything down here correct, that means she has 20/20 vision. So that is the Sinus chart examination. So the next test that I'm going to be doing, I'm going to be using my pen light, and I'm going to be testing the cardinal vision, which is the oculometer oculometer, which is the cranial nerve 3, 4, and the 6, with our oculomotor and truncator and the addison. So these nerves I'm going to be testing now. So I will go ahead and ask you, tell me when you see my finger.
Now.
Okay, now. So this, I would say that her peripheral vision is good. So at the same time, I am going to also ask you to look at my nose straight and follow my finger with your eyes. So patient is able to move her eyes, and that tells me that her cranial nerve is intact. So I am going to also shine this light from behind on her eyelids, and so as I bring this light, her eyes begin to constrict, begin to react because of the light. And we say that this is her eye is, the pupils are equal, round, and reactive to light and accommodation. So the next, I am going to use my ophthalmoscope to look into her eyes, and what I'll be looking for is the red reflex. So, and when using this, you want to use it in such a way that for the safety of the patient, because I don't want to bump my nose to the patient. So it's going to be my right eye to her right eyes, and my left eye to her left eyes. So in such a way, we don't have those awkward moments where I will be bumping into her nose. So this is my right eye. So I am going to be looking into her eyes. Sorry. I am going to be looking into her eyes, and I'm looking for that red reflex. Here it is. Then I will be doing the same on this part of the eyes with, okay. So that is it. So the most important thing that we need to know when doing this is the safety, because we don't want to make our patient feel that awkward on us while we are looking at their eyes, and while we're looking at their eyes and doing the examination. So another thing that I need to do here, after I finish the maxillary, I also want to come in here. When I come in here and I palpate here, and I want the patient to, can you open your mouth for me and close, open and close. So that is part of the facial examination that I skipped, and I needed to point that out. So the next examination that I have to do is the ear examination. So in doing the ear examination, I want to inspect the patient's ear like we always do. I am inspecting the ear for symmetry. I'm inspecting the ear for any kind of redness, anything that is around the ear. So making sure that they are the same on each side. So and then I am going to do a whisper test. Whisper test is basically occluding the ear and whispering at the back of the patient, so that way the patient does not see your lips and is not able to read your lips. So I'm going to do that test now. So I am going to close this ear, and I'm going to whisper something behind her. Yes. What did I say? Okay, I'm going to repeat it again. I don't know. So you're going to listen to what I'm saying, okay? What did you say? What did you hear? Apple. Okay, great. So she was hearing very well. So let's do something else here. Baseball. Good. So I said apple on the other ear, and I said baseball on the other ear, and then she got it right. So that is the whisper test. So in the next test that I will be doing is the Weber test. So I'm going to be doing the Weber test, and what we do is that we use a fork. So in the Weber test, you hit the fork and then you put it on the person's forehead or in the middle of their head, and they should be able to hear on both ears. So I'm going to test that on this patient. Tell me if you hear it on both sides, okay? Yes. So the patient is able to hear it on both sides. Then I am going to do the renal test. So the renal test, I am going to put it at the mastoid bone, and when it finish vibrating, when the patient stops hearing it, I want her to let me know, and then I'll put it in the ear, and if the patient should be able to hear it, because we say that the air conduction is usually higher than the bone conduction. So here we go. When you stop hearing it, let me know. Okay. 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 Can you hear it? I can hear it. Okay. So this is good. So we always want the air conduction to be higher than the bone conduction. So to be greater than the bone conduction. So this completes my hearing test on this patient. I am going to take my ophthalmoscope and I'm going to I'm going to look into her ears. What I'm going to be looking at is that I'm looking for any kind of obstruction, any excess wax, especially in the older adults. We always have those excess wax. So I'm going to use one of this for her ears, and then change it off when I want to look at her nose. Then I'll use another one for her nose. But for this time, so when doing this, we have to be conscious of safety, because somebody might push you or come across and then push you, and we don't want this to get into our patient's ear. So when doing this, we want to be cautious of our safety. You can hold it this way and then put your hands in this way, or you can hold it here and make sure you are holding in such a way that when somebody bump into you, this doesn't shove into the patient's eardrum and cause more harm. So, and the way we hold the ear, we usually pull the ear back up and down. You pull the pinner back and up for an adult. Because she's an adult, that's what I'm going to do. So we pull it up and then pull it down. So I'm going to be holding this here. I'm going to use this hand. I'm going to pull your ear up and then down. So I will be looking into your ear. Oh, this is good. It's clean and there is no obstruction. So I'm going to be doing the same on this side. I am, sorry, over her hair. So I'm going to be pulling up and down. So, and I'm going to be holding it in such a way I'm conscious that anyone that bumps into me, it's not going to push into the patient's eardrum. The safety is very important. So I'm going to change this up because I will need it when I do the nose. So change this and put the dirty one up here. So that completes my ear examination. So the next portion of my examination now is going to be her nose. So her nose, I am going to be looking for, inspecting it for symmetry. I'm inspecting for any redness, any discharge, which I don't see any. So the nose is clean and nice. So I am going to take my my ophthalmoscope, and I'm going to use another clean one for her. That's the container. So I'm taking a new clean one out of the container, and I'm going to be putting it in because this one is going to her nose, the other one went to her ear. So it's not good to use the same one for the ear and the nose. So I have it's on. So what I am going to be doing is that I'm going to be looking at your nose, and I will ask you to please tilt your head for me a little bit. So I'm going to take this and I'm looking in. I'm looking for any spectrum deviation, which everything is clear and good, nice and good, pinkish. There is no anything. So I'm looking for spectrum deviation, and the mucosa is usually pinkish. So that is my test for the nose. So the next test I am going to be going is her mouth. So I'm going to go to her mouth, and first of all, I'm going to inspect her mouth for any crack, any redness, any dryness on the lips, which I am looking at it. There is no crack, there is no redness, there is no any this kind of discharge, there is no, it is symmetrical, there is no any asymmetry, there is no dryness on the lips. And then I am going to look into the mouth and see further what is in there. Ask the patient to open her mouth for me. So do you mind opening your mouth for me, ma'am?
Yeah.
Okay, so she open. So when the mouth is open, what I'm looking at her tongue, I'm going to look for any deviation, any kind of abnormalities, any drooling. I am looking at her dentation, and if you don't mind keeping it open while I explain to my instructor. So I'm looking for any dentation issue, if there is the lineage, the hard palate, and then I'm looking at the mucosa buccal, which you can put on the gloves and palpate it. Let me grab the gloves down here. Medium. You put on the gloves and palpate the buccal mucosa and ask the patient to see if he has any tenderness or any pain. So this is my patient. I'm going to be palpating the buccal mucosa. Do you have any tenderness or any pain?
No.
No. So, okay. So that is my test for this. And while I am in there, I am looking at the duct and the sublingual duct underneath her tongue. I'm looking at that redness and looking at the uval and looking at it. I already asked the patient to do I want to see the tonsil. I want to see the size. I want to see if there's any swollen in that tonsil, which there is none in this patient. So she is good. And so that's complete my test for the mouth. And the final test that I have that I'm going to be doing today is the neck test. So while I am on her neck, I will be inspecting the neck for symmetry. I'm inspecting the trachea, to see how symmetry, if it's midline, which it is. If you palpate it, and you can see it's midline here. But before I go into palpating on her lymph, I want to check her range of motion. Can you hyperflex for me? Can you bring it down for me? Can you go lateral to the other side and this other side? Can you shrug your shoulder for me? So I am testing her range of motion, how she can move the neck, if she can move the neck every of this direction. Then let me go further to palpating her, looking for lymph nodes in this patient. So what I am going to do at this point is I want to start my palpation by going into the preocular, which is here in the front of the ear. I'm palpating for any lymph node, which there is nothing I can see here. And then I go here, and I'm the back of the ear. I have the posterior ocular, and there is nothing. I come here. This is her tonsillar. I'm going into her tonsillar. Then I have the occipital at the back here. This is the occipital of this patient. Then I am going to go to the mandibular, submandibular, which is right here. This is her submandibular. I come in to palpate at the submental. This is her submental. Then I will go down to the anterior cervical. Then I go to the posterior cervical. And the next one is called the deep cervical. In the deep cervical, I would like her to turn her neck like this, and this is round here. That is where I do my deep cervical. And can you turn to the other side too? This is my deep cervical when she turned her neck to the other side. Then I have another one which is the clavicle, and then I have the anterior clavicle, and then I have the posterior clavicle, and then I have the interclavicle. So the interclavicle is just between the posterior and the anterior clavicle. So this brings me, and there is no node that I see in this patient, but if there is anything that I see, like the nodes, the node has to be movable, it has to be non-tender. But if it's tender and unmovable, that is like hard, it's a cause for concern, and we may need a further test examination to clarify that. And this brings me to the end of this examination, and thank you for letting me do it on you.
You're welcome.